So we've been dispatched to a 55-year-old male who's had an unwitnessed collapse. Before we approach our scene, we want to make sure we have all of our gear, plus our PPE, gloves, glasses and boots. When we approach our scene, we want to be thinking about hazards to ourselves or our patient, such as wet, cold surfaces, sharp objects, pets, bystanders, and we want to look out for a potential mechanism of injury. We also want to think about our access, egress, and our distance to closest hospital. Are you here to approach, Jen?
Yeah.
Fantastic. Hello, sir. Got no response to voice or pain. Just going to take a look in the airway, which is clear. I'm going to listen and feel for breathing for 10 seconds. We've got to speak to cardiac arrest. Jen, can you please get out the pads, pop them on, and then call for backup?
ET-com,
Comms, go ahead.
confirming R49, requesting R50.
Roger.
Fantastic. Now I'll just get you to push charge. Great. And start getting out our airway equipment. Thank you. Okay. So I'm just going to analyse and let you know.
Yeah.
Analysing in 3, 2, 1. VF, shock, clear. Thank you. And I'll just get you to set up some airway equipment. So that last shock was at 45 seconds. We'll reassess at 2 minutes 45. Chuck it in a size 4 LMA.
Yeah.
Once you've got that in, we'll check for chest rise and fall. And then I'll get you to set up the bag valve mask for flow rate of oxygen.
Yeah.
15 litres per minute. Count you down.
Yeah.
3, 2, 1. Fantastic. We've got felt good chest rise and fall. So I'll just get you to set up the bacterial filter and the capnography on there, Jen. Thank you, comms connector. So at this stage, we'd want to be asking any bystanders if they witnessed the collapse, what happened prior to the collapse, or if they have any medical history on our patient. Today we don't, so we're just going to have to go off what we can see. Thank you, Jen. So we want to ventilate continuously. Now we've got our LMA in on the outstroke of every 10th compression. So let's get you to secure that LMA.
Yeah.
Thank you. Yeah, finish doing that comms connector. Thank you. And we'll just continuously ventilate from an upstroke of every 10th compression.
Yep.
So we're going to reanalyse 2 minutes 45. So I'll ask you to push shock now. Then I'll ask you to come around to my right hand side. Yep. And I'll count you down to take over compressions, okay?
Yeah.
3, 2, 1. From there. Okay. So we're in. I'm just going to analyse. Get you to jump off the chest.
3, 2, 1.
We're in asystole, so dump shock back on. Thank you. And I'm just going to continue ventilating. Can you count out loud your compressions? Yep. So that last shock was at 3 minutes. We're going to.
19.
Thank you. Reanalyse at 5 minutes. Okay. So now we have our ABC set up. Thank you very much. With our airway adjunct in place, we've got oxygen going at a flow rate of 15 litres per minute, and we've got continuous compressions going. So now we can start thinking about. Thank you. We can start thinking about our reversible causes. So our H's and T's. For our T's, we've got trauma, thrombus, toxins, tension pneumothorax. Yep. And cardiac tamponade. And for our H's, we want to be thinking about hypoxia, hyperkalemia, hypovolemia, hypothermia, and acidosis. So today our patient's not feeling too cold. I don't see any obvious
19.
Deformities or any blood. When we have more hands on deck, we're going to do a trauma sweep.
19.
Also take the lungs for lung sounds. Thank you. Get a BGL. How you going, Jen?
Good. 19.
Thank you. So as I say, we've got our ABC sorted out. Keeping an eye on our. Thank you. Thinking about our
19.
reversible causes. Very good.
19.
So we're just keeping going with compressions
10.
at a rate of 100 to 110 compressions per minute.
19.
Continuing with the ventilations.
19.
Thank you. Okay, so Jen, I'm going to push shock. I'm going to push charge and come around to your right side, and we're going to do another swap, okay?
Yeah.
After this one. After this ventilation.
19.
Okay. Just going to come around to your side. And you count me down for
You ready?
swapping places, okay? Yeah, I'm ready.
3, 2, 1.
Now get ready to count you down.
Yep.
1, 2, 3. We're in asystole. Dump.
Dump shock.
Thank
go.
you. And continuing with those ventilations every 10th upstroke, okay?
Yeah.
So that check, that shock was, that check was at,
10.
thank you, 5:20. So we're going to reassess at 7:20 and continue until backup arrives.